Okay, so this video is about kinesiotaping the lower spine for low back pain, sprains, you name it. Somebody has it, you have it. Very difficult body part to tape yourself. Trust me, it is doable, but it just takes practice, patience, and just likely just one piece or two pieces. And it's typically seated where you're taping yourself, you're reaching around with your hands behind your back. But this video is going to be about taping the lumbar spine and your options. So if you only have 2 pieces of tape, 4 pieces of tape, you typically do not need more than 4 pieces. And what we want to do is I'm going to start the video by showing you how to get started, and you could do this face down on anybody, but you can also do it seated. So what we're going to do is about halfway through we're going to have her sit up, and then I'm going to finish with it seated. And there's a reason why I want to show you seated, because if somebody is doing this for you and you guys are doing this together and you see this video, you're gonna go, oh yeah, there's that one part in the video that she tells me to move a certain way and it makes the tape last longer. So can't do that laying down. So let's start with it laying down and then do the rest of it seated, okay? So always ask permission. Do you want me to kinesiotape you?
Yes, please.
Do you mind if I lift the shirt up to expose the skin?
No, that's fine.
Okay, so what you do is you just expose the area that you're going to work on. And so if you don't know the body parts here, what you could just, most people wear their pants right at the top of the pelvis, and it's pretty obvious, this sway right here. So again, if you don't know anatomy and you're just taping your spouse or your best friend, you're gonna know if you're on the low back, and you can say, you could, take one spot at like a finger and say, okay, is the pain right here? And you can tell them, no, it's higher, or no, it's lower. And so what you want to do is taping the pelvis is a whole nother ball of wax, but we're not getting into. But if the person is like, oh, it's down in the waist, well, then we're redoing the whole thing. So this is really just focusing on the low back. So most people that have low back pain, they typically hurt the very, very bottom of the spine. So what we'll do, we'll show you this case, and then often this problem has gone into here, or it's gone out here and into here. So some people have only hurt one side, and you can just tape one side. And if you've watched any of my other videos, then you know I'm all about taping around the problem, over the problem, not just going, there's right low back pain and we just tape everything. That's not necessary. You can do it, isn't gonna hurt anything, but it isn't necessary. And sometimes if you're not good at taping, you're just throwing tape everywhere. So again, identify where the majority of the symptom and the pain might be, and then really kind of focusing your tape around that in a sequence. So let's grab some tape and go from here. With this, you can cut about this length. Lots of squares on this one. We've got the green, different tape here, no squares at all. So these are the pre-cuts, obviously. And what we're gonna do is start with 2, and then if you have and you wanna use 4, then you can use all 4. So we'll put these in my pocket. We'll lay this one here on you. There you go. You have a little piece of paper that just came off of you. So we're gonna do the twist and tear. It's kind of one motion. You don't have to do it, you can do it fast, you can do it slow. And then it ripped it apart. Peel one back. You're exposing basically just the middle third. I've got the other edges here. I'm gonna do a slight pull. We're just gonna lay it across the bottom, like so. So that was about a 50% pressure. And then with these, there's not gonna be any pull. We're just attaching these, like this. Now, some people can just stop here. They just want one piece. And if you think, oh, it's just a a slight low back pain, maybe it's just one piece. But if it's moderate, or it's been going on for weeks, or they're getting ready to go play tennis in the low back, you typically would go and use more tape. So let's identify that with Jessica here, that the problem migrated up. It's an entire area of low back pain. She's told you, maybe you identified it, and so what you could do is you could put another one across. So it would be the twist tear, slight opening, grabbing the sides, slight pull and pressure and opening, and then laying them down. I have seen people lay them really close. I particularly like to keep spaces in between to keep more blood flow happening. So this one, it's longer only because we're off a little bit. Patient's not gonna know, like this one, I just pulled harder on that one, so this one went a little bit further. Not gonna make a difference at all because I didn't stretch the ends, I only stretched the middle. And so again, some people use the back. I think it's scratchy, like it feels scratchy. So you can say, okay, I'm gonna basically rub this tape and really shove it and make it stick to the skin like that. But usually most people's body heat is enough to get that to adhere pretty quick, unless they're cold individuals. So while the videotape is still running, we've decided that she's just gonna spin and sit right up. So I'm gonna just kind of pull this down, go for it. Perfect. So again, we are going to ask permission to expose the skin. And then typically when I do this, I have the patient help me hold the shirt. So if I know that I need it, so I kind of say, okay, no, I'm gonna have you, just grab the edges and then just relax, okay? So what we'll do here is, if there's a strap, if it's a woman, we're gonna have a strap typically. If not, what we can do is we can just kind of inch a little higher like this, and then everything can be relaxed. You don't want them stressing out any of the upper body to put this here. So what I'm gonna do here, again, so that you could do this completely seated, right? But what we're gonna do here is we're gonna do either one side. If it's really a one-sided problem, you don't need to do two. And if it's a global area, you can do two. So personally, I'm just gonna tell you my own personal experience with a disc herniation and an injury here. I had one across and one down, and it was so helpful. I was even shocked. So, and that was just two pieces. So some people like to think more tape is better, and it is not necessarily the case. So we're gonna change colors. I'll put it in my pocket. Edit all that out. So what we're gonna do, again, twist and tear. And sometimes these are too long. Let me show you how this can be too long. Because even if we stretch it, now we're down here, and now we're up here, and now you're dealing with clothing. So if you have an issue with that, shorten your tape. Trim it shorter. There's nothing to say that just this piece alone, or a half piece, or a 3/4 piece isn't gonna do the job. Okay, so I'm gonna show you one side with dealing with a whole piece that you didn't cut, and what comes with that. Not that it's difficult or challenging, but it just may not be what you want, especially if you're working on like a 13-year-old baseball player or something like that. So I'll show you what happens with the full piece, and I'll show you why it's sometimes beneficial to do this seated. So all I'm gonna do is open it up, keep those ends attached, have it adhere, give it a little tug, have it adhere, okay? And then I'm gonna leave this one alone, and I'm gonna tell her to bend forward and to the left a little bit. So she's really stretching that tape out, and so now I'm gonna get this one to stick here. again, I'm leaving these long so you can see what I'm having to deal with, so you know, and then come back to neutral. So what that does is making her really stretch it and then getting the ends to attach. It typically will really, really help the athlete or anybody that's having to bend over or move, not continually get these pieces to pop off. And then that gets super annoying because the edges will curl, it'll grab the clothing, and before you know it, they're trying to get somebody to rip this off of them because it's grabbing and pulling. So it's sometimes better if you look and you go, oh, this is just too long, I'm having to deal with all this. I'll show you what it's like. Again, like I said, I'm gonna shorten it just a tiny bit, and then we're still gonna go through the same thing, but we're gonna go forward in the opposite direction. So, handy dandy scissors. Rip tear, not all the way to the end, just exposing the center. I do want this to end here and end here just with my pressure. So I'm gonna put this one here, get it to adhere, give it a pull, guide it, get that piece that's exposed in the middle, and then here. And then I'm gonna actually get you to bend forward and to the right, stretching this piece, stretch, stretch, stretch. And you can see how this just literally is coming off. That is so much easier to do. And then this one here. So now you can see why we just shorten the piece and then you can come back up and not having to deal with the clothing and all that excessive parts. Okay. That is all she wrote.
Nice.